if the POTS symptoms are really difficult to manage and the hydration, electrolytes, and compression garments are not doing the trick, it's a good idea to speak with your physician about one of these additional medications. Hi, I'm Dr. Clair Francomano, and this is my YouTube channel where we talk about all things related to Ehlers-Danlos syndromes and the hypermobility spectrum disorders. Today we're going to talk about POTS, postural orthostatic tachycardia syndrome, and we're going to discuss the main causes of POTS and some things that I have found in my long practice of taking care of patients with EDS and HSD that can be very helpful in managing the symptoms of POTS. So, why do people with Ehlers-Danlos syndromes and hypermobility spectrum disorders develop postural orthostatic tachycardia syndrome? There are several reasons behind this. One is that we know that people with hereditary connective tissue disorders have lax connective tissue in their veins. And so the veins can dilate and the blood pools in the feet and the legs. We know that people can put up to a third of their blood volume in their feet and their legs when this happens. And so that only leaves 2/3 of the blood volume left to circulate to the heart, the lungs, and the head. The heart starts to work overtime to generate enough oxygen carrying capacity to feed the heart, the lungs, and the head, and that results in what we call tachycardia, or a rapid heartbeat. And that's counterproductive because between each heartbeat, the heart has to dilate and the blood has to fill in the heart in order for each heartbeat to generate enough pressure and enough volume to get to the rest of the organs. So if the heart is beating too fast, each stroke of the heart does not deliver enough blood, and people start to feel woozy, dizzy, lightheaded, and they have brain fog. Their brain isn't working as well as it should. Another reason why people can develop the postural orthostatic tachycardia syndrome symptoms is if the autonomic nervous system itself is not working properly. Now, the autonomic nervous system is the part of the nervous system that controls all of those parts of the nervous system that we don't have to think about every day. Things like the heart rate, the blood pressure, temperature regulation in the body, controls our sleep function, the motility of the GI tract, lots and lots of different functions that just happen automatically day by day. So if the autonomic nervous system is not working as it should be, we have an overdrive of what we call the sympathetic side of the autonomic nervous system. The sympathetic and the parasympathetic nervous systems are the constituent parts of the autonomic nervous system. And those two things kind of work in a balance as we go through our day. Ordinarily, sometimes the sympathetic is a little bit higher, sometimes the parasympathetic is a little bit higher, but in general, we like to see a good balance between the sympathetic and the parasympathetic. The sympathetic side of the autonomic nervous system controls what we call the fight or flight reactions. And those are things that go into overdrive when the body feels like it's under threat. The parasympathetic side is the rest and digest functions. And those are the things that go into kick into gear when we've had a nice meal, when we're relaxing, we're among friends, and we know everything is safe. So when people are living in chronic pain, when their joints are constantly going out of joint and they're unstable, the body feels like it's under threat. And those stress hormones kick in, and the sympathetic nervous system goes into overdrive, and it overrides the functions of the parasympathetic. So all the things that happen when we're under stress, increased heart rate, our eyes dilate really wide, and so on, we're in hyper alert state. That's what happens when the sympathetic nervous system is in overdrive, and that contributes to these symptoms of postural orthostatic tachycardia syndrome because the heart rate is going super fast. Another reason that people with EDS and HSD can experience POTS is if there's an anatomic cause of compression of the part of the brain that controls the autonomic nervous system. And that can happen in situations like craniocervical instability or upper cervical instability or a Chiari malformation, where the posterior part of the brain that controls the autonomic nervous system is being compressed. So those are some of the reasons that we can experience postural orthostatic tachycardia syndrome. But what can we do about it? Well, the first thing is to make sure that people stay adequately hydrated. You have to have enough water on board in order for the blood volume that's circulating throughout the body to be adequate. So adequate hydration is the number one thing. And generally, the rule of thumb is that you want to be consuming at least half your weight in ounces of water. Now, the weight in pounds, so take your weight in pounds, divide that by 2. That's the number of ounces of water that you should be drinking every day. And by the way, most of us don't come even close to consuming that amount of water. So it's something, some people, you might really have to work up to it in order to get that adequate amount of hydration into the body. The second thing is you want to make sure you have enough electrolytes on board. So it's our kidneys' job to balance the water and the salt. And if we're taking in a huge amount more water, but we're not adding a little bit more salt to it, the kidneys are going to eliminate that water in the form of urine. We're going to just pee it right out, and it won't do us any good to drink the water if we don't have the salt on board to tell the kidneys that there's a good balance between the salt and the water. So electrolyte supplements, there are many, many of them out there. New one, NUUN, is a tablet that you can put in your water, and it makes an electrolyte drink. There's a product called Vitacium Salt Stick capsules, where you can just take 1 or 2 capsules 2 or 3 times a day, and that will adequately replete or maintain the amount of electrolytes in your body. But there are many, many others that are out there. You want to try to find one without too many artificial ingredients and without too much sugar. Compression garments can also be extremely helpful, and that will help with that problem of the blood pooling that I was describing earlier, where the compression garments help the veins in the legs pump the blood back up into the rest of the core of the body and get that whole blood volume circulating to your heart, your lungs, and your head. You can also purchase compression garments like bike shorts, compression bike shorts, or compression leggings. There are compression undergarments such as the Spanx undergarments, and all of these will help with the venous return to the central core of the body and improve the circulating blood volume to your heart, your lungs, and your head, and improve those symptoms of POTS. So the hydration, electrolytes, and compression garments are sort of the core treatments that we use, the recommendations for managing POTS symptoms, but sometimes these are not adequate, and you may need additional medication to manage the symptoms of POTS. So there's some medications that help the body hold on to water, so improving the circulating blood volume. There are other medications that slow the heart rate. These are called the beta blocker medications. And one of the issues with the beta blocker medications is that many of them also drop the blood pressure in addition to slowing down the heart rate. And that dropping in the blood pressure can increase some of the POTS symptoms. So it's a balancing act. There is one new medication that is called Corlinor, or Ivabradine is the generic name, and that is a medication that will slow the heart rate, but without dropping the blood pressure. So if the POTS symptoms are really difficult to manage and the hydration, electrolytes, and compression garments are not doing the trick, it's a good idea to speak with your physician about one of these additional medications that may help manage the POTS symptoms. There's a group of physicians in France that have also been recommending supplemental oxygen as another adjunct to treatment of the brain fog that's associated with POTS. And they recommend using oxygen concentrator, which can actually take the oxygen out of the air and deliver a concentrated form of oxygen back to the person through a nasal cannula. And that additional oxygen can help with the brain fog that is associated with POTS symptoms. So the recommendation for that is to use between 2 and 3 liters of oxygen from the oxygen concentrator for 15 minutes or 20 minutes at a time, 2 or 3 times a day. So that is a synopsis of some of the best approaches to the management of symptoms of POTS that I have found in my career of taking care of patients with these symptoms. I have one other recommendation, actually. There is a new book out by Dr. Peter Rowe, and it is called Living Well with Orthostatic Intolerance. I highly recommend this to you. He goes through a lifetime of experience that Dr. Rowe has accumulated over his career in treating patients with POTS and chronic fatigue syndrome. And I really think you will find that many, many helpful recommendations in this excellent new volume, Living Well with Orthostatic Intolerance. So that's a wrap. Thanks so much for spending the time with me. If you've enjoyed this discussion, you might also like my video about dysautonomia, which you can find at this link. And I hope you'll join me again for future videos.